Sure. I am Dr. Fatma Inanici. I'm an MD, PhD, specialized in rehabilitation medicine and neuroscience. After 20 years of clinical experience, I pursued my PhD to focus solely on research to address the limitations I witness in standard clinical neurorehabilitation. By combining clinical insights with rigorous scientific inquiry, my aim is to create next generation of therapies for individuals who are living with neurological disorders. Now my work focuses on leveraging neuroplasticity to develop experimental interventions that may restore sensory motor function, reduce spasticity, reduce pain, chronic pain especially. So this is where I am now. My day-to-day depends on our active research activities, research sessions. Rehabilitation research is unique because the treatment is long and quite intense. I am right there with the research participants 3 times per week for 3 to 5 months as they go through experimental treatments combined with exercise therapy. Also, I spend a lot of time on detailed functional electrophysiological assessments to see how they are recovering. Outside of those sessions, my time is dedicated for scholar side of the job, like reading latest literature, analyzing data, planning new studies, writing manuscripts and grant applications are really essential for sustaining and expanding our research. My transition into full-time research was driven by my frontline experience as a clinician. Over 2 decades, I witnessed the gap between existing neurorehabilitation strategies and also the unmet needs of my patients. Traditional rehabilitation focuses on compensation, which means helping the patients to optimize their lives within their limits, the limits of their injury. My work now aims to shift this paradigm towards restoration. I moved from the clinic to the laboratory because we can do more than just manage disability. We can leverage neuroplasticity to basically restore function and independence. In my research, I use non-invasive transcutaneous spinal cord stimulation, which is applied with surface electrodes. It's non-invasive. Historically, the primary limiting factor for transcutaneous spinal cord stimulation was the pain barrier, which is skin discomfort that prevents the delivery of the therapeutic level of stimulation intensities. But now we have a new technology that uses a 10 kilohertz carrier frequency, which effectively masks the therapeutic low frequency pulses and allows us for stimulate and deeper current penetration into the spinal cord without activating the pain receptors. This engineering breakthrough enables us to deliver the stimulation dose required for neuroplasticity non-invasively during the intensive rehabilitation sessions, and also ensures both participant tolerance and clinical efficacy. Yeah, as I mentioned earlier, as a clinician, I became aware of the gap between existing treatments through functional recovery. I choose to pursue a PhD because I didn't want to just practice medicine, but I wanted to evolve it. And this dual training allowed me to identify clinical limitations at the bedside and then return to the lab with the advanced research skills that I gained during my PhD training, so I can develop this kind of interventions and finally improve patients' quality of life, hopefully. Of course, this award honored my initial work, as I am one of the pioneers of this treatment approach. And this study provided proof of concept. But beyond the award itself, the true victory is the FDA approval of this treatment as a life-changing technology for individuals with spinal cord injury on a global scale. This is a big shift in neurorehabilitation. For the FDA approval, a multi-center, multinational study provided the efficacy and safety data with a larger sample size, and I was a part of this study. Now I'm advancing my research to optimize stimulation parameters further for longer-term plasticity, for other problems other than sensory-motor problems. And also I'm testing the therapeutic potential of this approach for other neurological disorders like stroke and multiple sclerosis. I am part of American Stroke Association, which is a part of American Heart Association. Being part of these organizations has a really meaningful impact on my daily work. These groups keep me connected to the newest scientific findings, emerging technologies in rehabilitation, and through conferences, workshops, and shared resources, I stay up to date on advances in the areas such as neural engineering, translational science, and patient-centered rehabilitation strategies. So this knowledge directly shapes the way I design research studies, evaluate new interventions, and think about long-term goals for improving patients' outcomes. My participation also works in the opposite direction. My research findings contribute back to these communities when I share our findings through presentations, papers, posters. It helps to expand the collective understanding of the recovery after spinal cord injury, multiple sclerosis, or stroke. These organizations provide me a platform to communicate our work and also, of course, to learn from each other. The most vital advice I would give my younger self is to engage in interdisciplinary collaboration as early as possible, because rehabilitation science requires a combination of medicine, engineering, neuroscience. It's a, group team. Lots of people are involved in rehabilitation science. So, and most significant career opportunities came from collaborations outside of my original fields of training. So I really benefited from this interdisciplinary collaboration. Also, I would definitely tell my younger self not to underestimate how much good mentorship matters. A great mentor does more than just offer guidance. They open doors to new networks, show you opportunities you might have missed on your own. So having a good mentor as early as possible is really very, very important. Oh, actually, restoring sensory motor function is itself an act of social equity.
Yeah.
Neurological disorders can be deeply isolating and often lead to economic issues as well. By focusing on restoration of the hand and arm function, I'm working to return the tools of independence to the individual. Whether it's the ability to return to workforce or just perform self-care activities without assistance, improving quality of life is the most direct way to advocate for a person's right to participate fully in the society. The other thing, by focusing on research on non-invasive spinal cord stimulation, transcutaneous spinal cord stimulation, I'm intentionally choosing a path of accessibility. This technology can be implanted anywhere, in community clinics or even potentially at home, making advanced neuromodulation available to a much broader population. The alternative of transcutaneous stimulation is epidural stimulation, which requires surgical implants. It may cause some insurance issues. Insurance may be restricted. It requires advanced neurosurgical centers, advanced clinicians to apply this. So transcutaneous spinal cord stimulation is, can be accessible for everyone. Neuroscience definitely changes everything. It teaches you how adaptable and resilient our brain is, and so we are. Understanding neuroplasticity, you realize that habits are not just things you do, but they are physical pathways in your brain. I know firsthand that I can develop skills, change a habit by repeating the action, my behavior, my actions, and that strengthens the circuits in the brain, which is called long-term potentiation. This is incredibly empowering. Oh, photography is one of my favorite ways to unwind. There is something calming about noticing light, shapes, small details that I usually rush past during the day. It slows me down, lets me present, and also reminds me that there is beauty in everyday moments if you pause long enough to see it. I also love cooking, not necessarily following a recipe, but trying out new combinations or add my touches to the recipes. So both photography and cooking help me reset. So I'm from Mediterranean area.
Mm-hmm.
Lots of vegetable cooking in olive oil. They are my favorite. An amazing thing, a fun fact about the brain is that signals traveling through our neurons can reach speed up to 250 miles per hour, and that is faster than a race car. This is amazing. And the secret behind that incredible speed is a special insulating layer called myelin. So instead of moving in one continuous wave, the electrical impulse jumps between these tiny gaps in myelin, which makes it travel faster. I recommend everyone to let your brain entertain you. It's surprisingly good at it. Neuroscience is fun, and the nervous system is magical. Curiosity is a fantastic entertainment system, and this helps avoiding living the same day over and over. Be curious. You don't have to dive deep in neuroscience, but understand neuroscience and learn about neuroscience. That will be really entertaining.